Hello, this is Dr Prajna Shetty. I am available at Cloudnine Fertility Vashi, also available at Nexuscare, Nerul and Seawoods. Today, my topic of discussion is IUI. So, the full form of IUI is Intrauterine Insemination. It is one of the most common treatment options provided to the infertility couples. So, before going to IUI, let me just explain you what happens in natural fertility. So, this is parts of the female reproductive system: uterus, vagina, cervix, fallopian tubes and ovary. In a menstrual cycle, around middle of the menstrual cycle, that is in the day 14 or in and around, there will be one egg that is released from the ovary, and this will be picked up by the tubes, and the ovary or the egg wait in the tubes for the fertilization. When husband and wife have intercourse, the semen is deposited here in the vagina in millions, and out of millions only about lakhs to thousands sperm will reach here, and out of lakhs to thousands, hundreds to thousands of sperms will reach here. The sperm and egg will meet, it is called fertilization, and embryo is formed. Once embryo is formed, it will move back to the uterus and will get implanted in the endometrium or in the uterine cavity. So, the most important criteria for fertilization to happen or for the pregnancy to happen is there should be open tubes, there should be adequate number of eggs, the uterus where the pregnancy happens should be normal, and in males there should be adequate number of motile sperms. So for us to offer you IUI treatment, at least one of the two tubes should be open. There should be adequate number of eggs and adequate number of motile sperms. So what happens in intrauterine insemination is that we will be depositing semen here directly in the uterine cavity. So in the intrauterine insemination cycle, there are two parts. One is ovulation induction, the other one is intrauterine insemination. In the ovulation induction part, we will be giving tablets or injections to the woman and help her ovulate 2 or 3 eggs instead of 1 egg that she usually does naturally. So once the 2 or 3 eggs are released, we will call the husband at the fertility center, and at the hospital he will be collecting the semen and giving it to us. The semen sample is prepared in the lab. We will remove the debris, we will increase the motility, and we will select the best possible sperms with the best motility, and the semen is directly injected here in the uterine cavity. This procedure is very smooth without any pain. It hardly takes about 10 to 20 minutes and it is an OPD procedure. So once the intrauterine insemination is done, the female has to lie down the bed about 5 to 10 minutes, and after that she is allowed to go home. It doesn't interfere with her work, it doesn't interfere with her activity. And once the insemination is done, 2 weeks later she is asked to do a pregnancy test. This whole insemination cycle, it takes about 10 to 16 days depending on the patient profile, from the beginning, from the day of her periods. And the success rate of each cycle of IUI is about 15 to 20%, again depend on the patient profile. So the maximum number of IUI cycles that can be done is 4 to 6 cycles. But it is very important for the patient to understand that not to give up on IUI cycle. They have to do at least 3 to 4 cycles before giving up. And they also should understand that depending on the patient profile, early decision of IVF or ICSI will be taken. Thank you.